Good day everyone, my name is Erica May Serviano and our topic for today is mental health. Mental health describes a level of psychological well-being or an absence of a mental disorder. The World Health Organization defines mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. There are different types of mental health problems, some of which are common, such as depression and anxiety disorders, and some not so common, such as schizophrenia and bipolar disorder. Most recently, the field of global mental health has emerged, which has been defined as the area of study, research, and practice that places a priority on improving mental health and achieving equity in mental health for all people worldwide.
I am Erica Jane A. Sulongsawa, and now let's talk about psychological and physical signs and symptoms of mental illness. Many people have mental concern from time to time, but a whole concern becomes a mental illness when ongoing signs and symptoms cause frequent stress and affect your ability to function. A mental illness can make you miserable and can cause problems in your daily life, such as at school or work or in a relationship. In most cases, symptoms can be managed with a combination of medication and talk therapy. Symptoms. Signs and symptoms of mental illness can be varied depending on the disorder, circumstances, and other factors. Mental illness symptoms can affect your emotion, thoughts, and behavior. Example of signs and symptoms. First, feeling sad or down, confused thinking or reduced ability to concentrate, excessive fears or worries or extreme feelings of guilt, extreme mood change of high and lows, withdrawal from friends and activities, significant tiredness, low energy, or problems sleeping, detachment from reality, paranoia, or hallucinations, inability to cope with daily problems or stress, trouble understanding and relating to situation and to people, problems with alcohol or drug use, major changes in eating habits, sex drive changes, excessive anger, hostility, or violence, and last, suicidal thinking. Sometimes symptoms of a mental health disorder appear as physical problems, such as stomach pain, back pain, headache, or other unexplained aches and pains.
Hi, this is Ajanel Estaray. I will report to you the treatment for mental health problems or mental illness. The first one is psychotherapy or counseling. This is also called the talk therapy. It is one of the most common treatments for mental health disorders. It involves talking about your problems with mental health professionals. Talk therapy is often done on one-on-one. It can also be in a group setting or with your family. Individual and group talk therapy is sometimes helpful. This type of therapy can be useful even for those who not have mental health condition and are simply going through challenging life situation like grief, divorce, and etc. The next one is prescription medicine. Prescription medicine is another popular treatment method. Medicines for mental disorders make changes to brain chemicals that are involved in emotion and thought patterns. Medicines don't cure psychiatric condition, but they can improve your symptoms. Supports group. Supports groups and self-help can help you gain insight into your condition. They can provide friendships, support, resources, and tips how to live with your condition. They also address the feelings of isolation that often go along with mental health conditions. There are many types of therapies people use to help mental health problems. This can include physical activities such as exercise of yoga. They can also include creative therapies done using means of expressing yourself creatively. They can include using art, music, movement, or writing.
Good day everyone, I'm Anisel Tapro. I will discuss about treatment with medication. Medication are mainly helpful for people who are more seriously affected by mental illness. These are the different types of medication treat different types of mental illness. Antidepressant medications. About 60 to 70% of people with depression respond to initial antidepressant treatment. These medications are now also used in combination with psychological therapies to treat phobias, panic disorder, obsessive compulsive disorder, and eating disorder. Antipsychotic medications are used to treat psychotic illness, for example, schizophrenia and bipolar disorder. Newer antipsychotic medications may have some side effects, but tend to have fewer of the effects that were associated with the older medications. For example, stiffening and weakening of the muscles. Mood stabilizing medications are helpful for people who have bipolar disorder, previously known as manic depression. These medications, such as lithium carbonate, can help reduce the recurrence of major depression and can help reduce the manic. The next is other forms of treatment. Effective treatments involve more than medications. Treatment may also involve community support, including information, accommodation, help with finding suitable work, training and education, psychosocial rehabilitation, and mutual support groups. Understanding and acceptance by community is very important. Electroconvulsive therapy or ECT. This treatment can be highly effective treatment for severe depressions and sometimes for other diagnoses when other treatments have not been effective. After the person is given a general anesthetic and muscle relaxant, an electrical current is passed through their brain. Hospitalizations. This only occurs when a person is acutely ill and needs intensive treatment for a short time. It is considered better for a person's mental health to treat them in the community, in their familiar surroundings. Involuntary treatment. This can occur when the psychiatrist recommends someone needs treatment but the person doesn't agree. In general, people receive involuntary treatment to ensure their own safety or that of others.
I am Katin Isa Taraim. Let's proceed to our topic, mental health services. Mental health services means intervention designed to provide the maximum reduction of mental disability and restoration or maintenance of functioning consistent with the requirements for learning, development, and enhanced self-efficiency. Any intervention, assessment, diagnosis, treatment offered in public, private, inpatient, or outpatient. What are mental health services and what do they provide? Mental health services integrated into primary care include the identification and treatment of mental disorders, refer to other levels, where required attention to the mental health needs of people with physical health problems, and mental health promotion and prevention. What is the importance of mental health services in our community? Mental health services also reduce the risk of chronic diseases related to stress, anxiety, and substance abuse. Most importantly, mental health services save lives while improving the outlook for people who may feel hopeless and lost.